I'm Professor Dr. Shireen Musallam, and now I will speak about part 3 of strongyloidiasis. We will speak about diagnosis of strongyloidiasis, the detailed diagnosis of strongyloidiasis. Of course, we should agree that parasitic infections are characterized by eosinophilia. So whenever we take a blood sample for the patient and we find moderate to high eosinophilia, this is very suggestive of the presence of worm infection, of parasitic infection. In this case, this patient should submit stool sample for examination. What we will see in this stool sample, should know first that this sample should be fresh. It shouldn't be retained for days. And we should ask the patient to supply repeated sampling. And why is that? Because the shedding of the larvae could be intermittent. It could descend one day and the other day it would not descend. So we take repeated 3 stool samples on alternate days. What do we expect to find in this stool sample when we examine it? As we said, that the larvae, which type of larvae, the rhabditiform larvae are expected to be seen in this stool sample. Is there a way to see any other stages in any other patient? Yes, of course. In constipated patient, as we said, that there is a very big chance for the rhabditiform larvae to transfer to the filariform larvae. And in this case, when we take the stool sample, we can find both rhabditiform and even filariform larvae. If this patient is suffering severe diarrhea, it will act like a purgative, as if he is taking a purgative. In these two cases, there will be a wash of all the content inside the small intestine, and that's why we can find larvae accompanied by the eggs, which were supposed to be present in a higher level in the small intestine and for hatching to give the larvae. But in this case, the severe diarrhea or the purgative stage, we will find the egg as well, because it is a sort of washing of all the content. Sometimes the infection is very scanty, and that's why the diagnosis could be not correct. In this case, we should do a concentration technique so that we can visualize the larvae, and this could happen through a flotation concentration technique, because the larvae are very light and they need a flotation concentration technique, and you took all the techniques in infectious 1 module. Sometimes we need to intervene and to take a duodenal aspiration. When would we need this stage? When would stool not be diagnostic or would mislead us? This could happen in hyperinfection syndrome. As we agreed that in the hyperinfection syndrome, the larvae will not descend on the stool because they penetrate the intestine and they disseminate in the body. In this case, they will not descend in the stool, and that's why this would be misleading. In this case, when we suspect the diagnosis, we instruct the patient to undergo duodenal aspiration either through intubation or through entero test. Sometimes sputum examination is of use as well. How is that? In which stage? We mentioned before that the migratory larvae in the normal life cycle stage migrate through the lung, and they jump from the lungs, from the pulmonary tissues to the esophagus. So when we take sputum sample, we can find the migratory filariform larvae. But of course, in heavy hyperinfection syndrome, we can find as well adults and eggs and all the larvae. But this happens only in hyperinfection syndrome. But normally, in the normal infection, we just detect the migratory larvae in the sputum of this infected person. So the main diagnosis happens from the stool. But in some cases, other specimens are of use, whether we are forced to take these specimens, such as in the case of the duodenal aspiration, or in case of sputum examination, either accidentally we could discover it, or to confirm our diagnosis. Thank you very much, and I wish that the lecture is simplified for you, and really the scheme will facilitate everything. It is a matter of understanding rather than a matter of studying. Thank you very much.